1 in every 2 dogs over 10 will develop cancer. That makes it the #1 killer of older dogs. But here is what most owners don't realize. By the time you see a visible symptom, it's been months. But what if you could catch it before you see it? Today, I'm giving you a 5-minute monthly home check. 5 specific things to look for once every month. This system catches warning signs weeks or months early. No equipment needed, no vet visit required. Just your hands, your eyes, and 4 minutes of attention. I'll also explain what's happening inside their body, so you understand why early detection changes everything. Let's start with a fact that surprises most people. Dogs get cancer at roughly the same rate as humans, but their bodies are smaller and lifespans are compressed. What takes years in a human takes months in a dog. That means cancer can progress very quickly and silently, and dogs are incredibly good at hiding pain. It's an instinct inherited from their wolf ancestors. In the wild, showing weakness made you a target. Your dog still carries that ancient survival programming, so they won't limp until the pain is unbearable. They won't stop eating until they physically cannot swallow. That's why you can't wait for obvious signs.
You need to look for what changes before the symptoms. Not, is something wrong, but what has changed. That single mental shift is the key to catching cancer early. Now let's talk about which cancers are most common. Lymphoma is one of the most frequent in older dogs. It attacks the lymph nodes, part of the immune system. You can actually feel swollen lymph nodes at home. That's the first item on your monthly checklist. Mast cell tumors are the second most common type. They often appear as small lumps on or under the skin. Running your hands over your dog's body is checklist item 2.
Hemangiosarcoma is the third type you should know about. It grows in the blood vessels, especially near the spleen. This one is harder to catch because it hides internally, but you can watch for sudden energy drops or pale gums. Checking gum color is checklist item number 3. Osteosarcoma is a bone cancer common in large breed dogs. It usually starts in the legs and causes sudden lameness. If your older dog suddenly limps, do not wait to call. Watching for limping changes is checklist item number 4. Now let's talk about the behavioral signs most people miss. A dog that suddenly changes where it sleeps is communicating. Changes in appetite are another signal worth tracking. Not just refusing food, but eating slower than normal, or drinking much more water than they used to. Tracking eating and drinking habits is checklist item 5.
So let's put the full checklist together right now. 1. Feel under the jaw for swollen lymph nodes. 2. Run your hands over their entire body for lumps. 3. Lift the lip and check their gum color. 4. Watch them walk and look for any gait changes. 5. Note any changes in eating, drinking, or energy. That's the entire system. 5 checks, 5 minutes a month.
Now, let's talk about what happens when you do catch something. The first step is usually a physical examination. Your vet will feel for lumps, check organs, and assess weight. If something concerns them, they'll recommend further testing. Blood work can reveal abnormalities invisible to the eye. Imaging, like X-rays or ultrasound, can find internal tumors. A biopsy tells you exactly what kind of cells are involved. This information lets your vet build the best treatment plan. And here's the critical point about early detection. Dogs diagnosed early have significantly more treatment options. Surgery can often remove a tumor completely if caught early. Chemotherapy in dogs is gentler than most people think. Most dogs tolerate it well and maintain good quality of life.
Radiation therapy can target tumors that surgery can't reach. The point is, options exist when you find it early. But when it's found late, those options narrow dramatically. That's the difference your monthly check can make. Weeks. That's all it takes to change the outcome.
Now let's talk about what your vet wishes you knew. Annual checkups matter more after your dog turns 7. After 10, many vets recommend checkups every 6 months. Your home check fills the gaps between those vet visits. Together, you and your vet become a detection team. Some breeds face higher cancer risk than others. Golden Retrievers have one of the highest cancer rates of any breed. Boxers, Rottweilers, and Bernese Mountain Dogs are also at risk. But cancer can affect any breed at any age, so the checklist applies to every dog owner watching this. Now let's cover the risk factors you can actually control. Obesity is a confirmed risk factor for cancer in dogs. Keeping your dog at a healthy weight reduces their risk. Diet quality matters too. Processed food isn't all equal. Talk to your vet about the best nutrition for your dog's age. Environmental toxins can also increase cancer risk significantly. Lawn chemicals, pesticides, and herbicides are all linked to cancer. Your dog walks through them and then licks their own paws. Wiping paws after walks is a simple way to reduce exposure. Secondhand smoke is another proven risk factor for dogs. Dogs living with smokers have higher rates of nasal and lung cancer. Reducing these exposures is something you can start today. Exercise is another powerful protective factor for older dogs. Regular, moderate walks keep the immune system strong and active. You don't need intense exercise. Consistency is what matters. Stress reduction also plays a role in cancer prevention. A calm, predictable routine helps your dog's body heal and defend. Sun protection matters too, especially for light-coated dogs. Limit direct sun exposure on their belly, nose, and ear tips. These small daily choices add up to real protection over time.
Now, I want to speak to you directly for a moment. If you're watching this, it's because you love your dog. That love is already the most important thing you can give. But love alone isn't enough to catch a disease that hides. You need a system, and now you have one. 5 minutes once a month could give you months more together. More walks, more mornings, more time on the couch together. That is what early detection is really about. Not statistics, not fear, just more good days together. Now here's what I'd like you to do next. Pick one day this month and do the full 5-point check. Lymph nodes, body scan, gum color, gait, habits. 5 checks, 5 minutes. That's the whole system. If you notice anything unusual, write it down and call your vet. Don't wait. Don't Google it. Just make the call.
Your vet would rather see your dog for nothing than miss something. That's what good veterinary care looks like. Partnership. If this video helped you, please share it with one friend. One friend who has a dog over 7 years old. That share could genuinely save a dog's life. Your dog doesn't know about any of this. They don't know about cancer, or checklists, or statistics. They only know that you're there. And that's enough for them. So be their advocate. Be their early warning system. Because they would do anything for you. And they can't do this. Start this month. Start this week. Start today. Your dog is counting on you, even if they don't know it. Thank you for watching the whole way through. Give your dog an extra hug tonight. They've earned it. And they've earned every single good day you can give them.